Welcome to Dank GH YouTube channel, your trusted CBT learning platform. To get the best out of your studies, kindly get a copy of the Ultimate CBT Guidebook for Adult and Mental Health Nurses. Available in UK and Ghana only. This video will take you through CBT mock questions with answers and references to better prepare you for your exams. Kindly subscribe to the channel for more. Question 1. The code contains the professional standards that registered nurses and midwives must uphold. UK nurses and midwives must act in line with the code, whether they are providing direct care to individuals, groups or communities, or bringing their professional knowledge to bear on nursing and midwifery practice in other roles, such as leadership, education or research. What 4 key areas does the code cover? A. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. B. Prioritize people, practice safely, preserve dignity, promote professionalism and trust. C. Prioritize care, practice effectively, preserve security, promote professionalism and trust. D. Prioritize care, practice safely, preserve security, promote kindness and trust. Correct answer is a red on the UK NMC Code of Conduct. Question 2. What is the role of the NMC? A. To represent or campaign on behalf of nurses and midwives. B. To regulate hospital or other healthcare settings in the UK. C. To regulate healthcare assistants. D. To regulate nurses and midwives in the UK to protect the public. Correct answer is D. The UK NMC is the professional body that regulates nurses and midwives in UK. Question 3. The NMC code expects nurse to safeguarding the health and well-being of public through the use of best available evidence in practice. Which of the following nursing actions will ensure this? A. Using isopropyl alcohol 70% to wipe skin prior to cannulation. B. Suggesting healthcare products or services that are still trialed. C. Ensure that the use of complementary or alternative therapies is safe and in the best interest of those in your care. D. All. Correct answer is C. According to the UK NMC Code of Conduct, nurses and midwives are to ensure that any information given is evidence-based and it's for the best interest and protection of the patient. Question 4. Which of the following is not one of the 6 fundamental values for nursing, midwifery and care staff set out in Compassion in Practice Nursing, Midwifery and Care Staff? A. Care. B. Consideration. C. Communication. D. Compassion. Correct answer is B. The 6 C's are commitment, courage, communication, competence, compassion and care. Question 5. Following the Francis Report, which of the following was the government's final response detailing the recommendations in dealing with the failings of Mid Staffordshire? A. The Francis Report. B. Liverpool Care Pathway. C. Hard Truths, Journey to Putting Patients First. D. The UK Healthcare Guideline. Answer C. This publication was the final response by the government to set out what the UK health and care system will prioritise. 6. A patient has been assessed as lacking capacity to make their own decisions. What government legislation or act should be referred to? A. Health and Social Care Act, 2012. B. Mental Health Act. C. Carers, Equal Opportunities, Act, 2004. D. Mental Health Capacity Act. Correct answer is D. The Mental Health Capacity Act makes sure that people who may lack capacity to make decisions on their own get the support they need to make those decisions, and when they are not able to make their own, decisions must be made that is in their best interests. Question 7. NMC requires in the UK how many units of continuing education units a nurse should have in 3 years? A. 35 units. B. 45 units. C. 55 units. D. 65 units. Answer is A. Watch the video on revalidation. Question 8. How many steps to discharge planning were identified by the Department of Health, DH 2010? A. 5 steps. B. 8 steps. C. 10 steps. D. 12 steps. Answer is C. The Department of Health identified 10 steps of discharge planning. Question 9. Which law provides communication aid to patient with disability? A. Communication Act. B. Equality Act. C. Mental Capacity Act. D. Children and Family Act. Correct answer is B. Watch the YouTube video on Equality Act. Question 10. Mental Capacity Act 2005 explores which of the following concepts? A. Mental capacity, advanced treatment decisions, and Act's code of practice. B. Mental capacity, independent mental capacity advocates, and the Act's code of practice. C. Mental capacity, advanced treatment decisions, independent mental capacity advocates, and the Act's code of practice. D. Mental capacity and the possible ethical and legal dilemmas in its interpretation. Correct answer is C. Thanks for watching. Kindly subscribe for more videos. To get the best from your studies, you can get a copy of the Ultimate CBT Guidebook available in Ghana and UK only.